Thousands of people in D.C. are expected to lose their health insurance once Medicaid cuts go into effect, and that could come as early as October 1st.
A part of that is because of cuts to the D.C. budget, and it also comes as Congress slashes funding of health care programs that help many people with disabilities and lower income people. Here with a look at the other ways this could impact our area is Sunrise on the Hill's Max Marcilla. So Max, let's start with the people who stand to lose their insurance. Who are they, and what impacts could this have on them?
Yeah, well, Hillary, we know that there's roughly 250,000 people on Medicaid in D.C. Who are them? Well, according to the Kaiser Family Foundation, 2 in 7 are children, and 64% of adults covered by Medicaid in D.C. are working adults. So these changes could have a significant impact on them, but not only on them and their health, but on the community at large. So we spoke with Leighton Koo, who's the director of the Center for Health Policy Research at George Washington University, and he says beyond those personal impacts of people who lose their health care, including, potentially becoming sicker or having undiagnosed illnesses or diseases, Koo says he expects to see the health market in the district struggle to respond. So in our interview, he painted a worst-case scenario where jobs could be cut at hospitals, especially hospitals in lower-income areas, and that could go for pharmacies and doctors' offices too, all of which could see revenues cut. Now, Koo cites the new Cedar Hill Regional Medical Center you see there in Southeast D.C. as potentially vulnerable, and that would be a big hit considering it just opened earlier this year.
This is going to cause a problem for a major emphasis to rebuild healthcare access in the poorest part of D.C. Hopefully the hospital will be able to survive, but certainly this throws in a kink that will challenge it.
Now, Koo says a large part of those issues are because of the cuts that Congress passed, but there is a local element. The Washington Post reports that more than 25,000 people will be kicked off Medicaid in D.C. and transition to a basic health care plan covered by the city, and that's on top of changes to the Health Care Alliance program that could impact nearly 30,000 adults. That's the district-funded program for low-income residents who are not eligible for Medicaid or Medicare. It includes many undocumented immigrants.
All right, Max, so you've identified the problem. What is being done to fix it?
Well, Koo says it's a tough problem to find solutions to. On one hand, he doesn't anticipate Congress reversing course, though he says maybe it will in the future. He also said it's a tight budget in D.C. He does say the impacts to the health market, though, maybe a bit of positive news. Those impacts could be slower to materialize. He compared it to the tariffs. Hillary and Corey, we just saw some of the businesses impacted by tariffs were able to shoulder some of those costs in the earliest days.